Lie on your back with your legs bent over a chair or an object that allows you to get a 90-degree angle bend at your knees and your hips. Make sure that your ankles are not higher or lower than your knees at any point in this position. The object must allow you to relax your legs completely so you don't have to use any of your own muscles to keep your legs in one position. If you notice that your knees are falling out, apart from each other, you can place a strap around them that will allow them to relax into the strap so they don't fall outward. Make sure that the strap doesn't have any kind of elasticity to it so that it presses in against your knees. You're going to place your arms out to your sides at a 45-degree angle from your body with your palms face up. Allow your lower back, hips, and shoulders to settle into the floor on their own. Balance and symmetry check. Pay attention to how your back, your hips, and your shoulders feel as they're lying against the floor. Do you notice that one side of your hips or other parts of your backs or shoulders is touching the ground or heavier into the ground more on one side than on the other? Take notes of any of these differences that are on one side of the body versus the other. They should settle down and become more symmetrical by the end of this position. You also have the ability to lie in this position for anywhere up to 10 to 15 minutes if you notice that you don't settle completely into the position. But it's not necessary to go longer than 10 or 15 minutes. Go onto your hands and your knees on the floor with your knees directly under your hips and your hands directly under your shoulders. From here, you're going to walk your hands forward between 5 and 6 inches. Then shift your weight forward so that your shoulders are directly over your wrists. Don't let your shoulders pass your wrists at any point during this exercise. At this point, there will be just over 90-degree angle at the hips. Using the muscles at the front of the hips, you're going to tip your pelvis forward to place an arch in your lower back. Once you've done this, let your shoulder blades completely collapse together as your chest sinks closer to the floor. Make sure that you do not bend your elbows while you're doing this. This might be tricky at first, as depending on how your shoulders move, your elbows are really going to want to compensate and not let you do both at the same time. This should get better over time, but make sure that you do not sacrifice by bending the elbows. Once you've got the shoulder blades dropped, the elbows are straight, and your pelvis is tipped forward, allow your head to completely drop and hang. You're going to hold this position for the recommended amount of time. If you have trouble or pain being on your wrists or your hands, you can drop down to your elbows. The rules here are slightly different. You want to make sure that your elbows are directly under your shoulders to start. They should be shoulder width apart. But you're going to separate your hands wider than your shoulders. Keep the palms facing each other. This time, you're going to shift your weight back slightly so that your hips go over your knees. Once you're there, tip your pelvis forward so that you have an arch in your lower back and use the muscles in the front of your hips to do so. Allow your shoulder blades to collapse, keeping your elbows at shoulder width and your hands further apart. Let your head drop and hold this position for 1 minute. Balance and symmetry check. Pay attention to any differences that you feel on one hip versus the other hip. Do you notice that it's easier to get one of the hips to work than the other? Or do you notice that you can't feel your hips working at all? Do you feel a difference in how easy it is for one shoulder to glide and move versus the other? Maybe you notice that one elbow doesn't bend as much as the other. Do you notice tension in the wrist on one side versus the other, or both wrists? Do you notice pain or discomfort on one side of your back versus the other, or maybe both sides of your back? Either way, take notes, and remember, these are all asymmetries showing up in the body that should even out over time. The number one most important part is to keep your elbows from bending and let your shoulders come together as much as they can possibly go while keeping the elbows straight. From here, spread your fingers wide and rotate your elbows in and out, having the movement come from the shoulders. The shoulder blades should be rotating in and out. Remember to keep your elbows straight and your shoulder blades together throughout the duration of this position. You also need to make sure that you're continuing having the pelvis tipped forward and the hip flexors engaged. Balance and symmetry check. Do you notice a difference with how one shoulder feels compared to the other when it comes to your ability to glide the shoulder blades together? How about the elbows with your ability to keep them straight? You also might notice a difference with the rotation between one shoulder and the other. Either way, these are all asymmetries showing up in the body and will change over time. Stand next to a wall facing the wall. Place your palms on the wall with your fingers pointed straight up. Make sure your wrists, elbows, and shoulders are in line. Your feet should be parallel and in line with your knees and hips. Walk back from the wall and sink your chest towards the ground until you have a straight line all the way from your hands to your pelvis. Using the muscles of the front of your hips, tip your pelvis forward to create an arch in your lower back. Make sure your heels are directly under your hips and keep your elbows locked straight. Once you're here, flex your quads tight and let the weight of your body go a little bit more towards the balls of your feet. Hold this position here. Balance and symmetry check. Do you feel a difference in how easy it is for your chest to sink down into the ground when it comes to paying attention to how your shoulders feel from left to right? Do you notice different muscles along your back that are working? These are all asymmetries that will get better and improve to become more symmetrical over time. Lie on your back with your feet flat on the wall. Make sure that there is a 90-degree angle behind your knees and at the hips. The legs should be about 4 to 6 inches apart and pointed straight up at the ceiling. Cross one ankle over to the opposite knee. If you feel difficulty getting that ankle over to the knee, even with the help of your hands, you can slide back a little bit away from the wall. Once you find a comfortable position, you're going to press that knee towards the wall, opening up the hip and using the muscles on the outer edge of the hip. Make sure that once you start pressing that knee, that your hips stay even and do not shift or rotate out to the side. With the foot that's still on the wall pointed straight up, pressing the knee out on the opposite leg and using the muscles on the outside of the hip, you're going to hold this position, keeping the upper body relaxed for the recommended amount of time. Then switch sides and repeat. Balance and symmetry check. Do you notice a difference in how much one hip opens versus the other? You might also determine that there's different muscles that are working in one leg versus the other. Pay attention to how the hips, the pelvis, the lower back, and the other parts of the back feel against the ground. Are they even from one side to the other? All of these are asymmetries that are showing up in the body and should even out over time. Start this position on your hands and your knees, with your hips directly over your knees and your shoulders directly over your hands. From here, you're going to shift your weight back so that your hips and your butt travel over your feet. You're going to stop this to where you're just about 5 to 6 inches above your heels. From here, you're going to walk your hands forward and allow your head and chest to sink down towards the floor. Once your head has reached the floor, you're going to make sure that your arms are completely straight, the elbows are completely locked, and your palms are going to have a slight downward pressure into the ground. The pressure is coming from your shoulders. Make sure that you keep your elbows completely straight. Make sure your knees stay at hip width apart the duration of this position. Do not let them go wider than hip width apart. From here, you're going to hold this position, making sure that you focus on breathing. As you take a deep breath in, you're going to let your stomach expand. And then as you breathe out, you're going to let your stomach contract in. Hold this position for the recommended amount of time. You should feel the work in the hip flexors and maybe in the quads or the muscles in the upper thighs as well. Balance and symmetry check. Do you feel the work happening in your hip flexors or your legs? Does it feel different from one side to the other? Do you feel like your pelvis or hips shift over to one side and you don't sit back quite evenly? Maybe you feel a difference in how your shoulders feel. All of these are asymmetries that are showing up in your body. And as time goes on, these should become more symmetrical. This position is going to start on your hands and your knees. But first, take a strap and tie it around your ankles so that there is about a 4 to 6 inch gap between the ankles. Make sure that the strap does not have any elasticity to it, as you do not want it to stretch at all. Starting back on your hands and knees with your knees directly under your hips and your hands directly under your shoulders, you're going to walk your hands about 6 inches forward in front of your body. Then shift your weight forward so that your shoulders go right on top of your wrists. From this point, you're going to roll your hips forward to place an arch in your lower back using the muscles in the front of your hips. Holding that, you're going to allow your shoulder blades to collapse together, which is going to allow your chest to sink down towards the floor. Allow your head to completely drop and hang. As you bring your shoulder blades together, do not allow your elbows to bend at all whatsoever. They must remain as straight as possible throughout this position. Holding this entire position, you're going to press out lightly against the strap on and off, using about 50% of your overall strength. You should feel the work in the muscles in the outer hips. There's also a chance that you could feel some of the work in the groin muscles. Balance and symmetry check. Pay attention to the difference in how easy or difficult it is to allow your shoulder blades to sink back together. Do you notice it to be more difficult on one side than the other? Do you have trouble keeping one elbow straight? Do you have trouble keeping both elbows straight? Do you have problems or tension in the wrist area? How about with the presses of the strap? Does the muscle work feel the same on both sides? Do you feel like it's easier to press into the strap on one side than it is on the other? Of course, these are all asymmetries of the body, and they should even out as time goes on. Lie on your back with your knees bent and your feet flat on the floor, hip-width apart and parallel to each other. Place a strap around your thighs just above your knees, and tighten the strap to make sure that there is about 4 to 6 inches between the knees. Make sure that the strap is a tight strap and it doesn't actually have any kind of give or elasticity to the strap. Place a small amount of pressure out against the strap for the entire duration of this exercise. Interlace your fingers fully behind your head and pull your elbows back so that they're touching the ground as close to the ground as they can get. If you notice that it's uncomfortable to get your elbows down to the ground, just get them as close as they will go. But make sure that you don't have pain to try to get them to get down to the ground. You're going to look at something on the ceiling that is slightly behind you so that your head tilts back just slightly. Continue looking at that spot the entire duration of the position. Raise your chest, shoulders, and feet off the floor at the same time. Make sure that you're only lifting about 2 to 4 inches off the floor. Then bring everything back down to the ground. Pay special attention to make sure that when your upper body goes into the air, that your head doesn't jut forward and neither do your elbows. You're trying to keep your head and your eyes back and focused on that spot on the ceiling, as well as keeping your elbows back as far as they can go. The idea here is that your upper back stays as much in extension as possible. Make sure that the feet as well as the upper body both lift at the exact same time and then lower down slowly at the exact same time. Fully relax between each repetition. You should feel the work in your hip flexors as well as your abdominal muscles. Balance and symmetry check. Pay attention to the differences that you feel in terms of how the hip flexors are working from one side to the other. Do you notice that one foot leaves the floor sooner than the other foot? Pay attention to any differences in how it feels to get your hands interlaced behind your back and when you pull the elbows back down towards the ground. Does one elbow find an easier time getting down to the ground than the other? This is asymmetry that is happening at the level of the shoulders, and this should change over time and become more symmetrical as time goes on. Start on your hands and your knees. Your knees should be directly below your hips and your hands should be directly below your shoulders. You're going to initiate the motion from your hips. Start by tucking your pelvis underneath, allowing your pelvis and your lower back to round. Then, imagine going vertebra by vertebra. You're going to start rounding every part of your back, from the lower back to the mid back to the upper back, and then allow the head to collapse down towards the floor. From here, you're going to start going into extension by tipping your pelvis forward using the muscles of the front of the hips. Now the goal here is to try to keep the rest of the back and the head in flexion as you tip the pelvis forward by itself as much as it can go. When you realize it can't go any further, you're going to start arching the lower back, then the mid back, then the upper back. As you get to the upper back, you're going to allow the shoulder blades to collapse together, keeping your elbows as locked as possible. Once you've gotten to that point, then your head and neck are going to be looking up. You'll now be in full extension. You're going to go back and forth between the movements, initiating the movement from your pelvis and then finishing the movement from the head. Try to prevent yourself from shifting back and forward, meaning keep your pelvis over your knees and keep your shoulders over your hands. Remember to breathe throughout this entire position. Balance and symmetry check. Pay attention to the differences between how one side of the body feels versus the other. Take notes of different things that stand out. Also pay attention to how difficult it is to move the body from one segment to the other. This tells you a lot about the relationship between the pelvis, the hips, and the shoulders. As this gets better over time, this segmentation should get easier. Place your back against a wall and keep your feet and knees about 6 inches apart. From here, you're going to walk away from the wall until you can allow yourself to slide down and put yourself in a seated position where you are about just over a 90-degree angle at the hips as well as the knees. The goal here is to have your mid-back, lower back, and hips completely flush against the wall. It's almost as though you're going to have a small slouch in your back and your posture in order to make this happen. Your head and shoulders will slightly come off the wall. Keep all of the pressure in your heels, relax your stomach, put your palms face up on your lap, and make sure that you do not use your upper body or shoulders at any point in this position. Keeping the pressure in your heels, you're going to hold this for the recommended amount of time. If you feel like a lot of the work is going into your knees, you can come up slightly until you don't feel the work in your knees anymore. You should feel the work in the upper thigh muscles, the quadriceps. Balance and symmetry check. Do you feel like both legs are working evenly, or do you feel like one leg is pushing into the ground or the wall more than the other? Take note in how even it feels where your back and hips are up against the wall. You might feel like it's not symmetrical from left to right, like certain parts of your back or your hips are touching the wall more than other parts. One thing that you can do if this is happening is to place a yoga block or some type of firm pillow between your knees where you're not necessarily going to squeeze it, but allow your knees to press into it, just enough to hold it, and see if that makes things even out. Over time, it should even out as things become more symmetrical.